I don't know about you, but I haven't been to an industry conference or opened a popular press magazine without seeing or hearing something about bovine congestive heart failure within the last year. This is one of those growing concerns that we've had in our industry, and something that at the American Angus Association, AGI, and all of our family of Angus entities that we're not taking lightly, and we're really helping and trying to support our industry in finding solutions for this condition that's gained a little bit of ground in the last several years. When we talk about congestive heart failure, the idea of cattle succumbing to a disease so late in the feeding period has been an ultimate concern since the early conversations that kind of really started around 2018. So when we look at the animal in this picture, a lot of us may look at that animal and say, he looks like he might be a chronic pneumonia case, or he looks like he might have an API. And that's probably why we haven't heard as much about this bovine congestive heart failure in the early years. So when you examine this animal, one of the first things that really sticks out to me is this brisket edema, right? That fluid buildup in the brisket, back into the midsection of its body through its navel. And you can almost start to see how this jugular is starting to be distended as you look up through this animal's throat, from his brisket up into his head. And then when we open these animals up that have succumbed to bovine congestive heart failure, we see a really malformed heart. So I have two hearts on the screen for you here today. On the right, there's an unaffected heart, right, where we have that strong V shape in our heart. This is what a strong, healthy heart should look like. We have a dominant right ventricle, a dominant left ventricle. We can see that there's kind of that median line right through the middle. This is a very well-shaped, healthy, normal-looking heart. And then when we look at this cross-section here, where this yellow line is, this is the cross-section of the top of the heart. You can see a well-defined left ventricle that has a lot of muscle around that left ventricle because it's pumping blood out into the body, where this right ventricle is receiving that blood. And that's what we really want to see when we necropsy these animals, or what we want to see in a healthy, normal-looking animal. When we have an animal that has succumbed to bovine congestive heart failure, basically what we're seeing is a very different remodeled heart. You can see in this affected heart, there's almost a U shape inside of that heart muscle. You can see that we don't have a well-defined right and left ventricle anymore. And then right at the top, you can see the pulmonary artery has really expanded, hypertrophied, and really changed kind of its shape and has become a lot wider and more distinct. When we take the top cross-section of that heart, this is where it really gets interesting for me. You can see severe remodeling when you look at it from the top. You can see that a lot of that muscle has kind of wore away in that left ventricle, where this right ventricle has really taken over a lot of the real estate when we start talking about this heart muscle. You can also see that when you look at this heart muscle, it almost looks like it's a bit blown apart. And when we think about what this heart would look like if we were standing right here and I had one on the table with me today, the veterinarians will tell you it almost looks like just a flaccid volleyball or basketball. It just has no shape. It just kind of sits there. And those are the animals that when we're calling this condition in the feed yards, that one of the prominent characteristics that we need to check the box on to say, yes, this was indefinitely a right heart failure. But before we just focus all of this session on the heart, I think it's important to talk about the whole system, the whole biological system of our bovine, because I think some of our cattle were set up for disadvantages in kind of just cardiovasculature from the start. And I think we need to take one step back and start to think about what's happening in our lungs. And these two pictures that I have on the screen right now, those are pictures that really start to tell the tale. If we look to the right, that is a picture of a set of inflated equine lungs. Okay, so you look at that set of inflated equine lungs, they're big, they're massive, they have a lot of volume. When we think about a racehorse running a race, right, at the Kentucky Derby or something like that, some of the reasons they can get so much speed and they can be so fast running around those tracks because they have that lung capacity to be able to take in the air and keep them oxygenated and keep them running really fast as really high advantage athletes. When we look at the picture on the left, that is a set of normal, healthy bovine lungs. So obviously vastly different in terms of the capacity, the volume, just the amount of air that those lungs would be able to intake on a daily basis. And so when we think about the disadvantages in cattle, and we think about what's happening with our right heart failure, it all kind of stems and starts with the lungs. And so, like I said, congestive heart failure has been a growing topic, and when we talk about that growing topic, it's the congestive heart failure that's happening in the feedlots. But we do know a lot about right heart failure or congestive heart failure, but at a different elevation. So for many of our producers that are grazing at high elevations, high altitudes, in the Rocky Mountains, in other mountain ranges, one of the things that they've obviously dealt with for a long period of time is this disease called high altitude disease. Sometimes it's also known as brisket disease, right? And when we looked at that first picture of that animal with that brisket edema or that fluid in its brisket, it was very similar to sometimes what we see at high elevations when cattle come down with high altitude disease. So basically what this is altitude-induced pulmonary hypertension, right? Which eventually leads to congestive right heart failure at high elevations. So like I said, we know a lot more about this disease than the current disease that we've been talking about for the last several years in the feedlots. We know that the stressor for these animals is that hypoxic environment where if I'm grazing at elevations, right, there's lower levels of pressurized oxygen, right, in the environment. And so as those animals continue to graze at those elevations for a long period of time, they actually can get chronic hypoxia that can lead to this high altitude disease. It's kind of similar to if you would take me, right, on a hike in the Rocky Mountains, and as I increase in elevation, it becomes harder for me to breathe. I might actually get lightheaded because I'm not getting enough oxygen in my blood. I probably need to sit down a little bit more than someone who's acclimated to that environment. Take some deep breaths, drink some water, and allow myself to recoup. The problem with cattle that are grazing at high elevations is that's where they're grazing. They're unable to move down far enough out of those hypoxic environments to give them relief. And so when some of our producers are experiencing those issues, one of the first things they'll try to do is, hey, can we get that calf moved down to a lower elevation that has more oxygen and see if they can recover. But basically one of the things that we've been able to do over the years is actually create a screening test, right, that allows us to select animals that are going to be more resistant to that high altitude disease. So where do the similarities come in? Like we talked about, this is right heart failure. So when we look at these two hearts, they should be eerily similar to the two hearts I just showed you on a couple of slides ago. When you look at these two hearts, these are two hearts where the one on the left, right, that's labeled a right heart failure, this is from an animal that was living at a high elevation environment and succumbed to high altitude disease. You see the very similar, almost basically the same type of physiology here where we had that U shape in the heart. Our pulmonary artery is inflated and inflamed, and we don't have that strong musculature of our right and left ventricle anymore in this right heart failure. So we know when these animals are dying of these two conditions that when we open them up and we necropsy them, they have a very similar phenotype to the heart. And when we talk about the progression of pulmonary hypertension, right, which we've been talking about both at high elevations and low elevations, a lot of times we lean on our friend Dr. Tim Holt, who's really what I consider the father of PAP testing. And we've leaned on him a lot to understand what is the remodeling in the heart that's taking place and how is the progression of pulmonary hypertension taking place in these particular animals. And again, the World Health Organization would consider this a type 3 pulmonary hypertension that's due to lung diseases and or chronic hypoxia. And so that's where high elevation, high altitude disease is going to fall. So basically where it all starts is with this alveolar hypoxia. And this is the most critical part in the chain because basically what that hypoxia is saying is that we're not getting enough oxygen into our bodies, okay? Obviously, if we're not getting enough oxygen into our bodies, we need to do something about that because we can't withstand under those environmental conditions. And so as people, a lot of what we do sometimes is we'll hyperventilate, right? We hyperventilate, we try to breathe a little bit quicker, right, in order to bring more oxygen into our systems. The other thing that our bodies will do is they'll actually start to go into our second line there of pulmonary vasoconstriction, okay? So pulmonary vasoconstriction is this idea that in our lungs, right, there's more oxygen available at the top of our lungs than at the bottom of our lungs. And so what our animals will actually do is they'll shunt blood up into the top of our lungs where there's more oxygen available to oxygenate the blood that gets then sent out to the rest of the body. And so through this shunting process, basically we have pulmonary remodeling, because as we shunt that blood into more oxygenated environments, right, our muscles have to work harder to put that blood where it needs to go. And that eventually will lead to pulmonary hypertension and right ventricular hypertrophy. And so if you remember our slides of that big U shape in that right ventricle, basically what's happening is that muscle is splitting and trying to create more muscle fibers, because as we shunt this blood in one direction, we have to force the blood out to the rest of the body. And then what happens is we try to make that heart muscle larger and larger and larger to be able to do that process. Eventually that will lead to right ventricular dilation and the eventual right heart congestive failure that we see when we talk about bovine congestive heart failure or high altitude disease. And so as we think about what is the potential genetic part of this whole system, well, it starts at the top with that alveolar hypoxia. How well can animals adapt to a chronic hypoxic environment? How much pressure is getting built up in my heart? And that's what we're actually measuring when we start talking about a PAP test, right? We use that catheter to run down into that animal's jugular and into its pulmonary artery, where we can actually capture that pressure measurement that allows us to understand how much pressure or how hard is that heart working in that particular environment. The second part of the critical genetic part is way at the end. While we know there's a heritability component to PAP, we know there's a heritability component to how well animals can withstand a hypoxic environment, there's also animals that maybe have a high pulmonary pressure, but they actually don't succumb to high altitude disease and or bovine congestive heart failure. Those are kind of our two places where, from my perspective at AGI, we're trying to actually provide solutions to you all that are listening to this particular webinar. So let's dive a little bit further into what a normal pulmonary artery gets, right, that has a normal pulmonary arterial pressure. So right here up on the top, we have this animal here that has a normal pulmonary artery with a PAP pressure of 40. You can see here that inside of this is the lumen of this artery. You can see it's nice and big with good musculature out of the outside. You can see that blood would be able to readily flow through that opening. If you go down here to this animal that has a pulmonary arterial pressure of 80 or a PAP measurement of 80, you can see here that there's a lot more muscle around this opening. And you can see that this opening is a lot smaller. So let's look at it in another picture here. Here's a picture that shows this very clearly. Very normal pulmonary artery, lots of room for blood to flow back and forth. We come over here and we have this animal that has a lot of hypertrophy happening, smooth muscle around its pulmonary artery, much smaller hole, right, for that blood to be forced through. So let's spend a minute talking about that. I think Dr. Tim Holt told me once, and it's the easiest way for me to kind of think about it and explain it when I start to think about the amount of muscle that's around that artery. Think about a garden hose. You have a garden hose outside, or maybe if you show cattle, right, you're rinsing cattle, but eventually, you know, there gets a kink in that hose, right? And a kink in the hose that basically then forces water through a much smaller hole. What happens to that water when it comes out the other end when you put a kink in that hose, right? That water comes out with more pressure, okay? So think of your pulmonary artery in the same way, right? When we basically make that hole smaller, we're forcing blood, right, through a much smaller hole. And so that blood is being forced with a lot more pressure, right? And that's what's starting to cause some of that dilation. It's what's causing some of that muscle hypertrophy, some of that breakdown, and eventually, basically, you outwork your heart. So let's look at it from another perspective. Here's a cross-section of two lungs. Again, this is a normal, healthy lung. You can see kind of all these individual small pulmonary arteries here, where there's a lot of arteries that will move that blood back and forth to basically get it oxygenated in the lungs. But then when we have this animal that's going through vasoconstriction, remember, kind of shunting our blood to a more neutral place so it can get oxygenated, those small arteries, they disappear. Because basically their bodies are shutting them off, right, vasoconstricting. And that's what's starting to lead, right? This vasoconstriction in the lungs is what's starting to lead to the pulmonary hypertension in the heart. So just quick review. We have these two animals. One's at a low elevation environment where they have all the oxygen in the world that they need in the air. Normal, healthy looking lungs, normal, healthy looking arterial arteries, we go to this animal that's been under that hypoxic environment, that stressful environment where they've started to basically vasoconstrict, right? Shunt that blood to portions of the lungs where there is more oxygen available. They're starting to build a lot of muscle in their pulmonary arteries, right? To be able to force that blood where they need it to be forced. You come here, that's where that pulmonary hypertension starts. And then eventually our right ventricle starts to go through hypertrophy. It's trying to create more muscle mass so it can work harder and force that blood where it needs to go. That leads to that right ventricle dilation, which eventually leads to that right congestive heart failure. The good news is for our members that are grazing cattle at high elevation environments, we've been able to start to collect PAP scores to measure the degree of pulmonary hypertension that exists in young animals, so we know which animals to keep and use as parents in the next generation. So these pulmonary arterial pressure measurements are measured by a trained veterinarian. This is not something me or any of my cohorts at 3201 are going to go out and be performing on individual animals. We need to have that trained veterinarian that's able to get us a good, accurate PAP measurement on our animals. With that, cattle need to be taken to the environment and acclimated to the environment in which they're going to be tested in. I can't per se take an animal here in Missouri that's been living at a very low elevation and take him to Denver, Colorado tomorrow, let him stay there for a couple of days and take his PAP measurement at that time. He needs to be acclimated to that environment so we can get an accurate measurement, right, of his pulmonary arterial pressure to really be able to tell whether or not he's a good candidate to graze and live at elevations. When we talk about these PAP scores, right, they have, like we mentioned before, have been found to be heritable. They're heritable at different ages and at different elevations. And so most of our seed stock breeders will take PAP measurements that are grazing at high elevations, take PAP measurements at yearling age or greater. But we've also found that weaning PAP measurements are very useful. So what we know about weaning PAP measurements are that cattle that are young, right, young cattle that at weaning age that have a high pulmonary arterial pressure, right, are already in kind of pulmonary hypertension, they're not going to get better as they age, right? So may not be a good candidate if they're already at an 80 PAP score at a young age, at yearling age. We've also found that different altitudes, we can have good heritability measurements for our PAP scores as well. So when we talk about that PAP EPD, the PAP EPD that we're predicting is high elevation yearling PAP, right, where a lower EPD is more favorable. And I mention that because we know that several of our breeders may not live at 5,500 feet and above, but live at 4 to 5,500 feet. And even those measurements at 4 to 5,500 feet allow us to have a bit more information and allow us to feed those PAP scores into that genetic evaluation to be able to help make a genetic assessment on how well those animals are going to survive at even higher elevations. So like we said, there's similarities between these two conditions, but there's still a lot of questions for me that go unanswered, particularly about bovine congestive heart failure. But what do we know, right? High altitude disease, it's that type 3 pulmonary hypertension that's affecting cattle at high altitudes, right? We know that that pulmonary artery begins to constrict and thicken as they continue to live in that low oxygenated environment. And we also know that selecting bulls, right, or females, but parents for the next generation with lower PAP EPDs have been successful at creating progeny that also have lower PAP scores. Lower PAP scores, right, is related to decreased risk of contracting high altitude disease. So what do we know about bovine congestive heart failure, right? We know this is a condition that basically cattle are succumbing to right heart failure. Those hearts look very similar to the hearts that we've necropsied out of cattle that have succumbed to this brisket disease at high elevations, but they're happening at low to moderate elevations, under 4,000 feet. We don't know what the direct cause is, and what I mean by that, we don't know what the direct cause is. We don't know why those animals are going into right heart failure, okay? We know that for cattle living at high elevations, that hypoxic environment, right, is causing those animals to go into pulmonary hypertension. It's causing those animals to cascade down that physiological pathway that we just talked about. But for cattle living at low elevations, obviously they don't have that same stressor. But they're experiencing this heart remodeling just like we would see at animals experiencing brisket disease. And so obviously this is something that we're keenly interested in. So as the condition has gained recognition, there was a lot of anecdotal facts that had came to the surface. So some of those facts, right, or some of those anecdotal facts were only cattle in their last days of life were succumbing to this disease. So I've heard a lot about late-term deaths in the feedlot, those sorts of things. We assumed when we first started kind of hearing more about this condition that it was only happening to those animals. It was only happening to animals that were at their end of life on their way to the harvest facility, and those were the animals that we were losing to this particular condition. We also heard that it's only the high-performing heavyweight steers. Maybe it's the only black-hided animals. It's only happening at feedlots that are 4,000 feet or greater. And I can remember in 2019, preparing for the Plant and Animal Genome Conference, we got a call from USMARC, the USDA's Meat Animal Research Center, and they were going to be presenting a paper. They had been working with a feedlot out in the Panhandle of Nebraska that were having some issues with cattle dying late in its late term life, right? And when they necropsied those animals, they saw that characteristic, right, of brisket disease, or that heart that went into congestive heart failure. And they had been focusing on kind of a case control study where they had 100 cases and 100 controls. And what they were trying to find is, were there any individual genetic markers that could explain why the animals, why the cases, right, succumbed to right heart failure, and why we had these normal healthy animals out of those same pens. And so they had identified about 20 markers that they thought could be candidates for controlling this particular condition. So obviously, as AGI, that perked our interest, and we started to explore, okay, if they were able to do that with 200 animals, could we actually do that on a much larger cohort and understand how well those markers could explain the variation, not just in one feedlot or 2 or 3 feedlots in western Nebraska or the Panhandle of Nebraska, but how well could they explain it for the rest of the American Angus population and, quite frankly, the beef industry. So we had that information out, and the first question we had is, could we actually replicate that USMARC study on a much larger scale? Okay, so before we could actually replicate it, what else do we need to know about this disease? How often is it happening? Is it happening? Are all those anecdotal facts real? Or are those just the perceptions that were out there? Because those were the things that people were willing to talk about. So what we did is we actually reached out to the Beef Cattle Institute, and this research, thank you to the Angus Foundation because they funded this research for us. And basically what we were able to do is work with Kansas State's Beef Cattle Institute to do a retrospective analysis of the risk factors associated with bovine congestive heart failure. And the reason we wanted to do this is because we wanted to figure out how often this was happening, and we wanted to understand if we could actually pinpoint animals that would be good candidates for a much larger study to kind of propel that work forward that USMARC did. So what we did is we took basically almost 4.6 million head of cattle. These were records that the Beef Cattle Institute had availability to, and we were able to look at that over a 3-year period. So 2016, 2018, 2019, and basically what they were looking at is they were categorizing, right, condition categories, such as things like atypical interstitial pneumonia, things like gastrointestinal or bloat issues, bovine respiratory disease, heart conditions, and other particular conditions that would have been recorded by those feedlot veterinarians at the time. So one of the first things that we looked at was just the percentage of the number of cattle that were received, how many of them actually succumbed to bovine congestive heart failure. So as you look at this graph, you can see here that this is our disease category. And through these papers, you'll notice that we talk about congestive heart failure as non-infectious heart disease. Okay? Obviously, there's other heart disease cases out there. We really wanted to focus on the congestive heart failure deaths, and so the non-infectious cases when it came down to it. So when we looked at the percent of diagnosis per disease category expressed as a total percentage of the fed cattle received, we found that less than 0.1% of cattle actually succumbed, of cattle placed on feed or total cattle received, actually succumbed to bovine congestive heart failure. So Obviously, when we think about that in a disease category or a condition category and we're trying to come up with solutions, we knew that, okay, if there's this lower percentage of cattle that are succumbing to this disease, we can't go out to a feedlot and just blanket collect genotypes or DNA samples and say, okay, we're just going to replicate that US Mark study by blanket genotyping a bunch of animals, and then we'll just wait and see in which pens do we actually see these cases pop up, because there is a very small proportion of these cattle actually succumbing to this disease. So while the prevalence is low, we know that congestive heart failure is a real issue. We saw that in the data. Reports have suggested that the prevalence, or at least correct diagnosis of the disease, may have risen over time. And so when we start to think about, okay, what were our next steps? We also thought that, okay, this initial study, we know the problem isn't probably going to take care of itself. If we wanted to do this large case control studies, they're not necessarily manageable in large-scale feeding operations because the prevalence is so low. So if we were going to try to genotype, right, enough animals to capture those few animals that were succumbing of this disease, right, we would have to sample thousands and thousands of animals, or we have to genotype thousands and thousands of animals. And quite honestly, from an economic standpoint, that just wasn't attainable at that time. So the next thing we wanted to do is we wanted to say, okay, if we still want to target this case control study, we're going to have to pinpoint, right, which animals are most susceptible of perhaps succumbing to right heart failure. And so we wanted to look at things like, are there differences in sex? Are there differences of when these cattle are placed on feed? Differences in arrival weight? When are these cattle succumbing to this disease? And is there a difference in breed? So as we started to try and answer some of these questions, remember some of the anecdotal facts were, hey, these cattle are dying of bovine congestive heart failure on their way to the truck, right, as they're headed to the harvest facility. What we found is that these congestive heart failure deaths on these 4.5 million head that we looked at were on average dying at 110 days of age. Okay, and you can kind of see this structure here. Dr. Blaine Johnson, who was the PhD student and now is a professor in Texas, who ran this research, did a really nice job of really trying to dig into this. And you can see that over this feeding period, we're seeing these bovine congestive heart failure deaths. So kind of that first anecdotal comment that we talked about, it's only happening in the late term feeding period, those sorts of things. Obviously, with this research, we found that, hey, that might not be entirely the case. And so when we looked at the number of congestive heart failure deaths that happened, right, over this 3-year period, there were about 32, almost 3,300 congestive heart failure deaths in these 4.5 million head that came from these 22 feed yards that were utilized in this particular project. So we know we can't just target late-term animals, right, or late feeding animals. So let's try to look at placement weights. People had said to us, it's only the high-performing animals that are coming in and succumbing to this disease. It's only the big animals that are heavy and they're being placed on feed. And so we wanted to look at that question the best we could too. So we basically segmented these cattle into arrival weight. And when we looked at arrival weight, you can see here that we saw maybe some observational differences in these cattle, but we didn't necessarily see a big break when we start to account for the standard errors in these different placement weight categories that would really say, hey, it's only the cattle that are arriving at X weight into the feed yard and go subsample them. So there was really no significant differences when we looked at it by arrival weight. But one of the things that we did notice, which I think goes to a point we mentioned earlier, is that in 2016, that's this lower portion of data here, you can see that we didn't have as high a probability or as many cattle placed on feed that were succumbing to bovine congestive heart failure. In 2017 and 2018, we had a few more animals that were being recognized and categorized as congestive heart failure deaths. And so that could indicate to us that, hey, while there's not a difference between arrival weight, we have seen an increase in more recent years. And that could be one or two things. Maybe it's happening more, or maybe we're just getting better at diagnosing it. The other thing that we wanted to look at, we couldn't really see a difference in arrival weight. We couldn't really see a difference in time on feed. But we also wanted to look at, well, if an animal was treated for a different disease during its time in the feed yard, do we actually see animals that were treated for one or two other diseases actually succumb more readily to bovine congestive heart failure? This would basically tell us that perhaps, right, animals that had a BRD event were more susceptible to succumbing to bovine congestive heart failure, and or maybe we were misdiagnosing those animals earlier and they were truly going into right heart failure, but we didn't know it until the necropsy was done. So what Blaine did is he went in here and he basically designed this by disease and weight category. You can see here that when we talk about things like BRD, we didn't really see a higher probability of heart disease if an animal was treated for BRD, or if an animal was never treated, or if an animal had basically a GI or bloat treatment while they were in the feed yard. What we can see is a little bit higher incidence of congestive heart failure, the probability of congestive heart failure death, if we see an API, that interstitial pneumonia, or if we have a complex disease case. So that complex disease case would be an animal that was treated 1 or 2 times for either the same disease or a different disease. That's where we've seen the higher probability of these animals succumbing to heart disease. The last question we wanted to ask is there a difference in breed? Obviously, in these records that we had, Blaine didn't have breed characterized in that data set, but he did have breed type. And breed type, I'm explaining that is basically beef, dairy, and a dairy beef cross animal. And when we looked at those 3 categories, and this is actually those 3 categories, beef, dairy, and dairy cross by elevation, you can see that there's not a lot of difference. At a lower elevation, you could maybe say that our beef animals have a little bit more congestive heart failure, probability of succumbing to congestive heart failure than our dairy animals, but then our crosses are right here. If we go to our second category, we have dairy animals here, again in the lower category, but then our dairy cross animals had a higher rate of succumbing to congestive heart failure. And then finally, in our third elevation category, you can see that now we have our dairy animals that have a higher rate of heart failure, where our beef and our dairy cross animals don't have as high a rate. And so that tells me that it's not just a straight bred beef industry problem. It's probably not just an Angus problem, but this is a problem that we're experiencing across the industry, across multiple different breed types. We did those 2 studies, right? The goal of those 2 studies were to say, okay, could we target animals that we could basically then genotype or collect DNA samples on to do that USDA Meat Animal Research Center project on a much larger scale. We looked at things like days on feed, we looked at things at like arrival weight and even breed type. And basically what happened is we came to the conclusion that there's no clear attributes, right, of those cattle prior to entry in the feedlot that would allow us to subsample. So what does this mean? It means finding target groups of animals to genotype on a large scale, that's probably not going to be a solution, at least for us here at AGI. And so we need to find an alternative that would allow us to collect thousands and thousands of phenotypes in a cost-effective manner in order for us to be able to say, is this genetic? Is it heritable? Can we control it somehow with genetic selection? And that's where kind of our next stage of research is leading us to. When we talk about this heart scoring system, this is post-mortem heart scoring, right? That's done at the harvest facility. And this is also championed by Dr. Tim Holt, who we talked about earlier with our pulmonary arterial pressure measurements. But what this heart scoring system could allow us to do is we could collect a large number of phenotypes, right, which all of our seed stock breeders know is very important when we're talking about a large-scale genetic evaluation. And we needed to do it affordably and easily. An issue that we see now as we're into this work, that as we look at this scoring system, it's a 1 through 5 scoring system, right, where 1 is that normal, healthy-looking heart, right, that picture should look a bit familiar. 1 and 2 are basically healthy hearts that are unaffected by pulmonary hypertension. When you start to see a 3 heart, you can start to see how this right ventricle, right, is starting to protrude out. You're starting to see a little bit more of that U shape instead of the strong, prominent V shape. A 4 heart here is an animal that looks like a pretty well affected heart, right? It's got that U. We start to see that this line between the right ventricle and the left ventricle is starting to be less dominant. And you can come up here and you can see this pulmonary artery that's really starting to get pretty large because it's built its muscle up to basically try to pump that blood into the heart. When you come over here to this 5, that's our affected heart that we were talking about earlier. The issue with this heart scoring system is a lot of times, at least in the data that we've collected so far, in a lot of different groups, we don't see a lot of these 5s in the plant, right? These 5s in the plant are the cattle that unfortunately didn't ever make it there. These are the ones that are succumbing at on average 110 days of age in the feeding phase because basically they've went into right heart failure. And so the reason I bring that up is that we're not able to basically collect all 5 of these scores very regularly, so we're relying on some of our feedlots to be able to collect genotypes and diagnose those heart scores of 5, right, which would be a bovine congestive heart failure right there in the feedlot. So what is the objective of what I term the Heart Health Project? Through this Heart Health Project, we're going to use this 1 through 5 scoring system. We've been putting people in the plant along the line, right, to stand there and actually score the physical hearts as they're rolling by. We've collected genotypes on those animals. We've collected heart scores on those animals. We have the information from the feedlot on those animals. And what we want to be able to do is try to estimate if there's a heritability to the degree of heart score remodeling in Angus cattle. Okay? If there is a heritability component, that would mean that part of this heart score remodeling is controlled by genetics. If part of it's controlled by genetics, we can estimate the relationships, the genetic relationships between heart score and other performance traits. A lot of our producers aren't going to be able to get in the plant and score cattle that they retained ownership on for this heart scoring system. But a lot of our members can collect weights, can collect ultrasound measurements, can collect a lot of other phenotypes that they have availability and access to, maybe even PAP scores. And so when we think about the relationships between heart scores and the other performance traits that we have in this database, this huge database that CStock members have been able to accumulate, that could be a step forward for us to understand and start to select against, right, congestive heart failure in the feedlot. So if all of those things come to fruition, we can develop this prototype EPD for healthier hearts, and we could actually potentially make genetic selection for it. So we know we would need large-scale phenotyping, right? We would need to know how heritable this trait was. But the other thing I know is that Angus producers have been keen to use genetic tools, known as EPDs, to make change inside of the U.S. beef industry. And if we give you a goal and you find that it's economically relevant to your situation, we know that you're going to be able to make progress with anything that we put in front of you. So as we look at some research that hasn't been done through the American Angus Association, but has been done in other research groups, here's some of the initial findings that we've seen. So this is some work from Dr. Scott Spidell from Colorado State University, where they've went in and collected about roughly 1,400 Angus-influenced cattle in the Texas Panhandle. What this graph is showing is that there's about a 29% incidence rate of heart score 3s and 4s in this data set. So the reason 3s and 4s, right, are important is because 3s and 4s are affected hearts, those hearts that are starting to remodel, that are starting to go into congestive heart failure. Here in this graph, you can also see that they didn't record any 5s when they took these heart scores in the plant. So there's definitely variation when we go into groups of cattle and start looking at the number of animals that have some degree of heart remodeling. The second thing that Dr. Spidell and his group were able to look at is the phenotypic differences that we see with increasing heart score in combination with carcass traits. So obviously when we think about marbling score, obviously marbling is something that our friends throughout the industry, in the feeding industry and the packing industry like to see, and also our consumer likes to see. So we want to understand, our cattle with higher marbling scores, right? Or how does heart remodeling affect marbling score as these cattle move towards right heart failure? So as you can see here in the 1 through 4 scoring system, if you have a 1 or a 2, you can see that those marbling scores continue to remain pretty consistent. But as we start to get into some of those affected categories, you can see as that heart remodeling progresses that they've seen a bit of a phenotypic difference, right, in those marbling scores as reported. If we look at another individual phenotypic difference of carcass weight, here, this particular graph, as far as from a phenotypic standpoint, gets a little more messy. But remember, these are just phenotypic differences, where you can see that in kind of our heart score of 4 categories, they did have lower carcass weights, but our heart score of 1s, right, didn't necessarily have a lot heavier carcass weights when you compared them to heart score phenotypes. So to take it one step further, because those were just phenotypic differences, Again, the Colorado State group had come out and looked and tried to understand if the phenotypic means are different, which we saw differences in the phenotypic means in that prior study, is there a genetic link? And so what they did in this particular study is, again, took a set of Angus-influenced cattle, right, at about 1,500 Angus-influenced cattle that were in a feedlot of about 1,000 meters. And they had about 88 unique sires represented in this particular study that had about 20 progeny each. And what they were trying to do and understand is, are there genetic correlations between these traits? And so this is the chart that we're going to look at next. So right here, HS, that is heart score, not to be confused with our hair shed EPD that we have out, but this is your heart score, right? Where with these 1,500 records, they came up with about a 28% heritability. Okay, so think about a 0.28 heritability. That's about as heritable as what we see with some of your gain traits, weaning weight, yearling weight. About the same degree of heritability. If you look at the correlation between heart score and some of our genetic correlations between hot carcass weight, back fat, ribeye area, and marbling, you can see there that there's basically zero genetic correlation with the marbling of these animals. With ribeye and back fat, we have moderate correlations, right, of low to moderate correlations of 0.15 with heart score and back fat, and 0.27 with ribeye area and heart score. And then you can see here that we have a little bit larger correlation with hot carcass weight, genetic correlation with hot carcass weight of 0.63. So to put that in perspective, when you guys are out there ultrasound scanning your individual animals, the correlation between ultrasound scan, carcass ultrasound scan data, and true carcass information and data that's available is about 0.6. And so about the same level of correlation that we have in those two particular traits. And this has been one that's been pretty interesting for me personally to think about, because when we think about heart score, with a 0.28 heritability in this initial study that was done outside the American Angus Association, it would give you the belief to say, hey, we can make genetic change by selecting, using an EPD, selecting against heart remodeling in different bovine breeds. However, you also can see with this 0.63 correlation that as we select against heart score, we're also going to decrease hot carcass weight. Okay, and so I've been talking to the feeding industry about this, trying to get as much information that's out there and available. And one of the things that they tell me, right, is obviously they don't want us to select against hot carcass weight. Okay, that's been a signal throughout the industry for many, many years that we want to continue to be able to create animals that are going to be profitable for our feeding industry, and some of that has to do with just the sheer weight of those animals. One question that comes up a lot is, well, what's the correlation between the heart scores that we're collecting in the plant and our PAP EPD? So what they did in this study is on these 1,500 animals, they took a subset of those 1,500 animals and actually PAP tested them at the feedlot prior to harvest. And you can see there that this correlation is almost 1, right, between PAP, the PAP score that they captured, and the heart score that they captured at the plant. However, you have to also understand that they collected these late in life. So these cattle that had the higher heart scores were already in pulmonary hypertension, right? We're already moving through that pathophysiological pathway, moving towards right heart failure. And so to me, it makes sense that PAP on animals that are 16 to 18 months of age that are close to being sent to the harvest facility would have higher PAP scores in relation to the heart scores that were collected at the plant. So to me, the verdict's still out whether or not heart score and PAP are that highly correlated, because most of the PAP measurements that we take are on younger animals at high elevations, and I know CSU is continuing to do some work on that. So we saw those initial research documents coming out of these different research institutions, and so that's a pretty good understanding for us to go ahead and say, okay, if we collect these phenotypes and we collect a big enough cohort of these phenotypes, we may be able to go out and carry out a research design that establishes postmortem heart score data collection with cattle with known parentage to develop some genetic selection tool to decrease the incidence of heart failure in feedlot cattle fed at low elevations. But in doing so, we also want to identify the degree of relationship between heart disease and other subclinical performance outcomes, things like marbling score, carcass weight, average daily gain, those sorts of things, because not only is that important for us to know, but it also could aid us in actually having some sort of multi-trait selection taking place if we were able to produce an EPD for decreased heart remodeling. So what we've been able to do is we've been able to reach beyond the Angus borders. We already talked about this earlier. I'm very well aware that C-stop producers aren't going to be able to get into the plant to score these hearts themselves. So we needed to launch this heart health initiative, and it was launched in 2020. We've went out and we've made relationships with people in the industry like Cargill and Five Rivers. We've had support of our whole Angus family, from our parent org at the American Angus Association, certified Angus beef, in the Angus Foundation, as well as academic and research institutions at USMARC, USDA, in Colorado State University, to try and gather this data and start to analyze what it means for Angus genetics. So here's what we've found so far. So these are 1,500 cattle, right, that were actually fed at the Five Rivers feed yard in Cooner, Colorado, and killed in Colorado. And there is variation amongst these scores. So much like some of the early reports from Dr. Scott Spidell's work, we had about a 23% incidence of what I'm terming affected hearts, 23% incidence of our 3s and our 4 categories. You can see here again, we didn't see any 5 heart scores as we were analyzing these individual animals in the plant. And you can also see that we have a large proportion of 1 and 2 heart scores. So normal, healthy hearts, those cattle were able to do exactly what they were supposed to do throughout their lifetime. When I compare the differences of the best and the worst individual animals, basically you can see here, this is our best lot, right? You have 1, 2s, and 3s. You have 12% 3s. You have no 4s in this particular group. You have almost 60% 1s. Remember, 1s are normal, healthy hearts. Here's our lot of cattle that was our absolute worst so far in our data set that we've been able to collect with Five Rivers, where we have 17% 1s, 42% 2s, 24% 3s, and then 4% of 4s. So as you can see here, we do have variation among these scores, which is positive because it's positive from a genetic research standpoint, because in order for us to make a genetic selection tool, obviously the phenotype we're collecting has to have some sort of variation in it. So as we wrap up this evening, I know we've given you a lot of information to chew on, but as we think about the differences in all that we've talked about tonight, we know that PAP is an indicator of high altitude disease. We also know that heart score either is the indicator trait of congestive heart failure, especially when we see those heart score of 5s. That's obviously the phenotype that we're looking for when we talk about heart failure, but we have these 1s, 2s, and 3s, right, that are indicators of how much remodeling has taken place in their heart. But I think all that to say is that we need good data recording in the field. We need to continue to work with our feedlot partners in our harvest facilities in order to collect these phenotypes, in order to really try to make progress as an industry coming together to make sure we can start to decrease the incidence of what we're seeing out in the field. Heart score genetic tools could potentially reduce the caseload, but when we think about a heritability of 0.28, it's probably not going to eliminate the condition entirely. I think when we think about anything that we've done in this industry, very few issues have been solved with genetics alone, right? So I would like to challenge everybody listening tonight as to what else can we do to combat this condition. When we think about a heritability of 0.28, it's about 30%. 70% of this is getting controlled by the environment, right? So how are we raising these animals? How are we managing these animals? And actually, can we manage them to a different place or to a different endpoint that would actually allow us to not see these right heart failure issues in our feedlots? We too are answering that call, right? At the American Angus Association, Angus Genetics, again, dipping into our relationship with the Angus Foundation, we're looking for answers beyond just this EPD or this genetic tool that may become a reality. We want to understand what other pathological or toxicological factors are present, right? So again, we're partnering with the Beef Cattle Institute at Kansas State University to determine if there are any of those changes that are taking place. We want to understand how feeding ionophores or ionophore profiles could be overlapping with these congestive heart failure mortalities and other mortalities that are taking place in the feed yard. We want to evaluate the hair and liver mineral profiles, specifically focusing on things that we know affect the cardiovascular system, like vitamin E and selenium. And then that last point, trying to understand, can we compare heart size between these heart failure cases and other mortalities that are happening in the feed yard to see if heart size relative to the estimated body weight could be causing an issue. I think that's something that we hear anecdotally, but there's no research out there to confirm or to deny that particular issue. And so just like we're asking you to think beyond just the genetic piece, we're also asking ourselves, how else can we put tools in the hands of our industry to help us combat this disease? If you guys have any questions, comments, feedback for us as we move this forward together as an industry, we welcome you to call us, to email us, to converse with us, because I think at this point in time, this has been a really big research effort that we continue to create questions for, continue to find answers for, and we hope that we can continue to support the industry in that way.
Wow, Kelli, thank you so much. You gave us a lot to digest there. Very impressive, all that information you had to provide us. Of course, though, that means we have lots of questions coming in for you, so you're not done quite yet. Starting with a question that was pre-submitted by Ricky from Canada. He says he manages a Finnish feedlot and looks for following signs for BCHF. Depressed behavior, sway back, shoulder separation, brisket, and jugular edema. He asked, though, is there other signs that he may be able to diagnose those early heart failures earlier on in order to help him better manage and market his cattle?
Yeah, I think that's a great question, Jessica. And the first caveat I'll say, I'm not a feedlot specialist. I'm not a veterinarian, right? I'm just a geneticist here in St. Joe that kind of has an affinity for this condition and is trying to help the industry solve this from a genetic perspective. But obviously those are kind of the list of traits that when we're talking to veterinarians, when we're talking to feedlot personnel, that they already have outlined there as far as some of the symptoms. And I think the more you see it, the more you know. I know some of the folks that work in those feedlot settings, they're pen riders and those folks out there that are checking those, especially making sure that they are aligning their records as to when they've treated an animal for respiratory disease. If that animal doesn't come kind of get better, doesn't come out of that respiratory event, things like that, and they still continue to be sick. I know some of those types of things are things where they kind of shine a light and they take a little closer eye on those. But there have been some feedlots that have been very effective, Jessica, in basically removing those cattle prior to succumbing to right heart failure and kind of getting them to the harvest facility prior to kind of succumbing to that ultimate fate.
This kind of ties in a little bit. Pat is asking, how young can you see those indications of heart failure? And are you seeing it? And do you know, is it more prevalent in males versus females?
Yeah, so obviously when we looked at that data, those congestive heart failure deaths that we saw averaged at 110 days of age. And then we kind of showed that chart where it was fairly distributed across the feeding period. And so definitely in those yards that we were able to work with through the Beef Cattle Institute, and there's about 26 feed yards, 4.5 million head, they were able to diagnose that early on, right? Earlier than 110 days on feed, because that was our average. And so for sure, those symptoms are popping up. They're not just symptoms that are coming right at the end of the feeding period or anything like that. From a males versus females perspective, we did look at that in some of those studies we did with the Beef Cattle Institute, and we didn't see any significant difference between sex, Jessica. Obviously, we had a higher percentage when you just looked at it kind of on the surface level, a higher percentage of males, but there's more males in the feed yard. So from that perspective, and when we really dug a little bit deeper, no true difference between those two sexes.
You mentioned ultrasounding for different reasons, but if somebody's ultrasounding, have we figured out a way to identify any type of symptoms like this using ultrasound rather than having to wait till they're on the rail?
That would be really nice for sure. I think that's why we're keenly interested in trying to figure out what's the overlap between PAP and congestive heart failure that we're seeing at lower elevations, because of the fact that could we use that as one of those indicator traits? We haven't had the greatest luck with PAP, and the same with ultrasound. We think of ultrasounding an animal and trying to get a picture of their heart. That's a pretty big animal that we're dealing with. In an animal that sometimes isn't the most cooperative, to try and get our ultrasound machines in there to take a picture long enough in order to capture those images. And so I actually spoke with Dr. Holt about that previously in some of our other conversations, and he said that this hasn't been a good way to be able to get a clear picture with an ultrasound machine just based on the animal that we're dealing with.
Yeah, and we were looking at the increase of congestive heart failure deaths since 2019. And someone asked, is this really an increase, or are we just educating people better and we're more aware to be able to say, hey, this was really this instead of what it may have been misdiagnosed with before?
Yeah, I think that's kind of one of those questions where the verdict's still out, right? Obviously we see those trends in the data, but I do think we're better at diagnosing it. I think we're better at realizing it. I think people are paying more attention to it. Whereas before we might have called that individual animal, right, AIP, or we would have called him a BRD case, something like that, because he's lethargic, right? He isn't getting around as well. All those traits that could be similar to some of those other, pneumonia-like symptoms that we're seeing. So I think it's probably a little of both, Jessica, quite honestly. We're feeding these cattle to heavier weights every single day. And obviously, as we feed those cattle longer into larger endpoints, they have more risk of something happening to them because they're in the feedlot for longer. And so I think there's a lot of different things that are probably coupled behind that, but misdiagnosis early on is definitely a factor.
Yeah, and you talk about that impact to the feedlot and to the economy overall. Has anybody really been able to quantify what that financial impact is when we look at this disease on the industry as a whole?
Yeah, I think when you look at the industry as a whole, in one of the larger data sets that we have is obviously one of those first studies that we talked about that Dr. Blaine Johnson was able to do for us at Kansas State there. And, less than 1% of cattle, 0.07% of cattle that are actually succumbing to this disease. I think the thing that we don't have qualified very well yet is what are the subclinical effects, right? And how are those subclinical effects actually affecting our economic outcomes as well, right? Because if cattle are going into pulmonary hypertension, and obviously they don't have the fitness that they once had, they're usually slower gaining, their feed efficiency could drop off a little bit. How does that affect the overall carcass? All those sorts of things that I think we still need to truly quantify as we continue to learn more from that perspective, Jessica.
Jumping right along in this was actually a pre-submitted question from Andrea. She's asking, are they looking at, and you mentioned some of the smaller different type of supplements that might be impacting it, but is there really a look at the type of feed and the rate of gain on those animals and that correlation?
Yeah, obviously the rate of gain question is a really good one. And I think we will be able to collect some of that out of some of the studies that we're doing, because we're going to have those heart scores right along with some feedlot performance data, and then obviously their carcass characteristics. So we'll be able to track, days on feed and have some pen intakes and some things like that. Some of those early studies were able to look at some things like feed to gain. And that's obviously a question that we're going to continue to monitor and we're going to continue to look at. I know Colorado State University, the folks out at Simplot, Landing Cattle have been focused on trying to run some of those studies. And I think when we think about, the correlation between all those production traits and in kind of your previous question, Jessica, about economic impact, it's going to vary in the operation. We see that percentage level across the industry, but I think some of these individual feedlots, and that's really where this conversation got started, whereas where we had a high level of these death rates, right, and some of those feedlots, and they were looking for answers because, it has a bigger economic impact on some individual feed yards rather than when you just compare it across the whole industry. And so obviously we can respect that. And that's, even though it's a low percentage, we know that it can have a big impact, especially in certain areas. So that's why we're committed as the Angus Association, AGI Foundation, CAB, kind of our whole gauntlet, right? That we've kind of come together and really tried to start to search for answers.
Yeah, absolutely. I do have a couple clarifying questions on the Cooner feedlot cattle that you were talking about there at the end. The 13% on the second slide about the miss, can you explain a little bit more what that meant?
Yeah, so some of those ones that they unfortunately were missed when they went across the line. So that could be, maybe the tag transfer didn't go well, something like that. And obviously what we don't want to do, because these heart scores are attached to genotypes inside of the database, and we want to look at genetic correlations, for those animals that we're not confident on getting that heart score on. Like I said, maybe it was a tag transfer issue. Maybe they were standing along the gut line and something happened in the plant and they just weren't able to look down and capture that particular heart at that particular time. Some of those things, unfortunately, right? We're working with, we're humans, right? And we're working in systems in conditions where we're not used to all the time. Obviously, I'm very confident in the scores we have in those plants and they do a really nice job, but unfortunately, sometimes things just happen.
They do. And sticking right with that, you showed your best and your worst lot out of that experiment. Were there any differences, controlled differences between those lots of cattle, or that just came out with such a different result from one lot to the next?
Yeah, so that's kind of what we're trying to figure out now, right? So those were some early preliminary statistics that our graduate student at CSU, Isaac, was able to put together for us, that we were able to use for this webinar in NCBA, where we first presented this presentation. And that's just kind of to give us a little dose of what we're seeing, but we continue to look at the rest of those factors, right? We want to know, was there a genetic difference? Where did those cattle come from in the United States? How long were they on feed? All those types of factors to try and pull apart, right? What really was truly the anchor behind seeing those differences. We have cattle outside of the Cooner feed yard too that we've been looking at and looking into. Obviously, we have great breeders in the Angus industry. They're running their own structured sire evaluation projects, Jessica. And so we've been able to pinpoint some of those groups and shout out to those producers who have been able to help us through that, because that's really nice data for us to utilize. And we see really interesting results in those groups as well. And so just excited about the project overall, and hopefully we can learn a whole bunch.
Yeah, can you go into a little bit more on the structured sire tie and collecting that data for AGI? That was actually a question that came in.
Yeah, so that kind of twofold. So first of all, Dr. Esther Tarpoff, right, from the American Angus Association, she's our director of performance program. She's probably on tonight. So she hopefully she asks us that question too. So that structured sire evaluation program is something that we run. It's really good data because we have true reference sires against test sires. So kind of more of those high accuracy sires that are tied really closely into our pedigrees against kind of younger sires that are up and coming. And what that allows us to do is to have really good carcass data, growth data, things like that to bring into the genetic evaluation. And we've been able to actually go out and collect those not only from the association structured sire evaluation project, but sire progeny tests that some of our members are doing as well. So very similar setup. They have reference sires that have a large amount of data in the carcass realm, those sorts of things. They're putting them up against test sires that are going to be highly used in our breed in the coming years. And so being able to kind of link those two things together, that data becomes important because we have those sires with ties into our database. And we're also, right, testing out young sires that we think are going to have a fairly big impact, right, on our pedigrees and inside of our Angus population to come. And so good data to have inside of there. It's structured data, well-defined contemporary groups. Those cattle are getting sent to the feed yard together. They're getting sent to the harvest facility together. And there's not a lot of culling that's taking place or pulling off that's taking place in those groups of cattle, so we can get a true test, if you will, of how those sires are performing.
We did have someone who asked, they have feedlot cattle close to harvest that they go ahead and DNA test. He said, how can we help the association collect the needed data at the time of kill? Yeah.
So absolutely. If you guys have tested herds out there or cattle that you test with DNA and you are, doing that for your own information, those sorts of things, reach out to us for sure. We've been working with individual producers as well as places like Five River Cattle Feeders to actually get groups on site to score. There's actually some plants that actually have scorers within their plants, right, where they'll go in and collect other data for them. And sometimes we're able to utilize those. So logistically, as long as we can get, the right scores in the right places at the right time, Jessica, we're happy to be able to try and work through some of that. I actually think I have a voicemail on my machine that I have to return. Somebody has a group of data that's going to kill here in Kansas in not too long. And they're all right pedigreed cattle that have genotypes on file. And we're going to try to get them in the program.
the more data you can collect, the better off you are, right, in solving this issue.
Yeah,
Do you
absolutely.
see a timeline as far as, the Heart Health Initiative? Is there a 2-year, 5-year, 10-year plan to saying, I think at that point we'll have the data to at least have
Sure.
some answers?
Yeah. So, that data set is ever growing, for sure. I think this summer we'll start to have some of those preliminary results. Obviously, the good thing about utilizing graduate students is they're always on a timeline, right? So they want to see results for their own projects. And so the pedal, the foot stays on the pedal, from that standpoint to keep these types of projects going. And so from that instance, I think we'll start to see some preliminary results out of our own project here this summer. Obviously, we saw some of those other peer-reviewed articles that are out there from other groups to kind of start to give us some answers, maybe tell us, hey, and point to where to look. But definitely want this project to be multi-year. And I think the other thing we have to be aware of is we'll get our preliminary answers, right, Jessica? And then we're going to have to follow up, and we're going to have, and let's say we get to a point where we have an EPD or we have a genetic selection tool to select against heart remodeling. We're going to have to continue to feed this data source. Just like any other of our traits, our Angus producers, everyone hears to say we need phenotypes, we need to make sure that these populations are current. It's going to be one and the same with this heart scoring. And so that's one of the things we're going to have to stay committed to for a very long time in order for us to keep that data structure current and keep it well-defined inside of the American Angus Association.
Absolutely. And our genetics are forever changing. So we're always adding to it, which keeps you on your toes.
Absolutely.
Speaking of those outside sources that may feed in a little bit, someone said they understand Neogen has developed a test for BCHF. Is that test something that adds new genetic value on the breeding side or the feedlot side? Is that something you're aware of?
Yeah, so that particular test, I believe they actually partnered with Simplot on that test. I think Simplot's probably the intelligence behind that test that they're bringing forward and those sorts of things. And a couple of the things that we still had questions on really led us down the route that we're taking. And we really want to understand, how having a group of heart score data really kind of interacts with other production traits from that standpoint within the larger Angus population here at the American Angus Association. And so we still have a lot of questions. They've done a lot of work. They've captured a lot of scores out there through that project. And so that's one where I think, as they continue to get access to data and they continue to try and do some testing as far as how good those predictions are, we'll continue to learn more at that and definitely look for strategic partnerships where we can.
Absolutely. Moving back just a little bit, following up with the question more closely tied to symptoms, identifying if you do see those symptoms in an animal, is it a total loss, or are there ways to go ahead and safely harvest that animal or mitigate them, move them into a different track?
Yeah, so we do have individuals that we'll call them rebrail those cattle, right? We try to move them to harvest a little bit quicker. We take them out of their feeding groups and take them to harvest. And if you're in a position where you can get that animal to the harvest facility safely in a timely manner, that has been an option for some folks. Obviously, some folks are far enough away from those harvest facilities where maybe the stress event of actually moving that animal, considering how far along they will be kind of in their heart failure event, that might be something that you want to take into consideration. But definitely early detection and trying to move those animals to the harvest facility is a reasonable option if kind of the stars align for your individual operations.
Yeah. And you mentioned that stress. A couple people have asked about heat stress in particular, and if you've been able to nail down any correlation there.
Yeah, not yet, but that's the beauty of us really being dedicated to creating our own data set, because we are going to have bulls, right, that have heart scores and maybe have things like hair shed scores. So nothing more confusing, Jessica, than having two HS, right, heart scores and hair shed scores. But that's one thing that we're kind of interested in, and just kind of looking at the overlap and seeing, is there a genetic correlation there between those two individual type traits, maybe even looking at, what's the correlation between PAP and hair shed. I think, when you start to think about things like pulmonary hypertension, heat stress, all those sorts of things. It really kind of goes to me. It kind of seems like it goes to the resiliency of those animals and trying to understand, what stress, overall, what stress pathways is that targeting? I've heard anecdotal comments from producers, even at high elevations when, they put those animals under stress, even if it's just, moving those cattle down off the mountain, those sorts of things where, brisket disease will flare its head and they could have an event during that time, right? And so, yeah, they maybe succumb to brisket disease, but the added stress kind of pushed them over the edge and some things like that. So really want to take a whole systems approach to this and really think about it from a broader stroke and just see what we can learn.
Absolutely. It sounds like there's lots to learn. You've learned a lot. We're excited to continue to learn with you. We've had great interaction. There's so many questions, but we don't have time for every single one. I want to leave you with the question of, as purebred C-stock breeders, what can that side of the industry do to support you, support the research, support the feedlots in helping solve this problem? What's the takeaway?
Yeah, for sure. I mean, we mentioned one at the beginning. The Angus Foundation is a big supporter of this work. They're able to help provide us with a lot of funding that we can go to the research universities, and we're able to put graduate students in the plans to collect these scores and things like that. And so definitely being able to having that foundation support from a research dollar standpoint has been really, really good for us at AGI and really good for us at the American Angus Association. So from a monetary standpoint, supporting our Angus Foundation in that research pillar is one that I would definitely share. And then from a secondary standpoint, continue to ask us questions, tell us your feedback. Also, if you have those kill groups that you have a commercial producer that's retaining ownership and, they're doing some AI and they have your walking sires walking around the pasture, contact us and let's see if we can work together to be able to get them into this research program. So I think those are the things that right now that we can do. Before we leave here tonight, Jessica, one clarifying statement for the people that are still on with us from that statement. I think when we were talking about some of that work that was done at CSU, I think I said that some of those PAT measurements on those low elevation cattle were taken at 16 to 18 months of age. They were taken more at like 14 months of age. Doesn't really change the outcome, but as a researcher, I don't like it when people misrepresent any of the data. And I think that was my brain must have been getting tired by the time I got to the end of that presentation, Jessica. So I just wanted to make sure that we clarified that for our audience too.
I appreciate that, Kelli, and no one would blame you after, a 55-minute presentation, all data, that you had one moment there. So again, we appreciate everything you do, the time you're spending, not only to do it, but take an evening out to explain it to all of us and make sure we're aware and educated about what's going on in the industry and how we can support and continue to move it forward. So thank you, Kelli.
Yeah, well, thank you, Jessica, for having us. And we love talking about our research and we get excited about it. So it's never an issue over here.
Yeah, well, we hope all of you who joined us tonight also enjoyed the programming, felt that it added value to your side of the industry, whatever that may be. We certainly are excited to see all of you on here when you join us. If you'll take just a few more minutes, we know your time's valuable, but take a few more minutes at the end of this call, give us a little feedback in our survey, let us know about Kelli and the work she's doing, as well as any other future topics that we might be able to provide you and help assist in your operation moving forward. So we do appreciate the time you've spent. We do have several topics coming down the pipeline. As soon as those are scheduled, we'll be sending out some email dates with our next programming. So thank you again and have a wonderful evening.